Methylcobalamin is used to treat vitamin B12 deficiency. Vitamin B12 is important for the brain and nerves and for the production of red blood cells. Methylcobalamin is sometimes used in people with pernicious anemia, diabetes, and other conditions. Indications. Methylcobalamin has been used as supplement in patients with vitamin B12 deficiency and in those with diabetes and other neuropathies. Although use in dementia is advocated, aside from correcting deficiencies, clinical trials are limited. How to use. Use methylcobalamin exactly as directed on the label or as prescribed by a doctor. You don't use in large or small amounts or for longer than recommended. Use exactly as directed on the label or as prescribed by a doctor. Oral megaloblastic anemia caused by vitamin B12 deficiency, peripheral neuropathy. Adult, 500 mcg 3 times per day. May adjust dose depending on patient age and severity of symptoms. Parenteral, megaloblastic anemia caused by vitamin B12 deficiency. Adult, 500 mcg via IVIM injection 3 times weekly for 2 months. Maintenance therapy, 500 mcg via IVIM injection every 1 to 3 months. Parenteral, peripheral neuropathy. Adult, 500 mcg via IVIM injection 3 times weekly. May adjust dose depending on patient age and severity of symptoms. Before taking this medicine, you should not use methylcobalamin if you are allergic to vitamin B12 or cobalt. Tell your doctor if you have ever had Leber's disease or other form of optic nerve damage, an iron or folic acid deficiency, or low levels of potassium in your blood. Tell your doctor if you are pregnant or breastfeeding. Don't give methylcobalamin to a child without medical advice. Warnings. Avoid drinking a large amount of alcohol. Heavy drinking can make it harder for your body to absorb methylcobalamin. Methylcobalamin should not be used in pregnancy to treat anemia unless it is vitamin B12 deficiency anemia. It should only be used upon the doctor's recommendation and after all the risks and benefits are discussed. People who have recent gastrointestinal surgery may have reduced absorption of methylcobalamin. The peak effect of methylcobalamin can be observed within 3 hours of taking it orally. In the case of methylcobalamin injection, the time taken to show its effect is 1 hour. Older people may have a reduced capacity to absorb methylcobalamin tablet through the intestine. However, no effect is there in absorption in case of methylcobalamin injection. It is well observed. Side effects. Get emergency medical help if you have signs of an allergic reaction, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Common side effects may include nausea, vomiting, diarrhea, loss of appetite or headache.